I'm Dr. Rachel Weinheimer, and I'm a colorectal surgeon at Texas Oncology in Amarillo. The topic of today's discussion is fecal incontinence. Fecal incontinence is the inability to control bowel movements. This can happen every once in a while, or it can happen all day, every day. Up to 1 in 12 people report symptoms of fecal incontinence, but unfortunately only up to 54% of those patients report ever having discussed it with their doctor. The point of today's discussion is to talk about the causes and the treatments of fecal incontinence so that patients can seek treatment if it is right for them. Most commonly, this condition affects women, the elderly, and in patients who have had a history of a complicated vaginal delivery. Fecal incontinence can be caused by new medications, chronic constipation, or weakness of the pelvic floor. One leading cause of pelvic floor weakness is obstetrical injury. When women have had multiple pregnancies or a prolonged labor, often the nerves and muscles of the pelvic floor can be injured and won't work as well. While this injury can often be masked in patients in their 20s and 30s who have a very robust pelvic floor, the addition of age-related muscle weakness can often tip patients over the edge so that they begin experiencing symptoms of fecal incontinence and severe urgency later in life. There are several treatment options available. Medical options involve slowing down and thickening up the stool. Pelvic floor physical therapy can also be very helpful in rebuilding that pelvic floor. The last option, which would be the surgical option, would be placement of a sacral nerve stimulator. This procedure involves placing a stimulator near the sacral nerve root that innervates the pelvic floor muscles. By providing these pelvic floor muscles with better sensation and better tone, it allows the patient to hold their stool better. While there is no clear-cut way to avoid fecal incontinence 100%, there are ways to maintain a healthy lifestyle so that you can limit your chances of developing this in the future. Maintaining a healthy diet, drinking adequate water, avoiding chronic constipation, exercising regularly, and maintaining a healthy weight are also very helpful in limiting chances of fecal incontinence. At Texas Oncology, we offer multidisciplinary care. Fecal incontinence is often multifactorial. Here at Texas Oncology, we provide counseling about dietary changes, we arrange for outpatient physical therapy, and also we set up surgical intervention if indicated. Every patient at Texas Oncology has access to a supportive team dedicated to achieving the best possible outcome.